the towels. I would check the machine for any abnormalities, make sure like the wire's fine. Then I would verify the patient, make sure they're supposed to be doing it, make sure their medicine is correct for the patient. Then I would check, see any contraindications, like their, oh my gosh, contraindications, sensitive to skin sensitivity, sensitive to metals, or allergic to the medication, like I said before. Then I would ask if they had a previous history with ionto. No?
No.
Then I would do light touch perception, capillary refill, then I'll do pulse. Then I would make sure the area is clear for any open wounds or any cuts. Then I would make sure that there is no like lotion on it, or they're not like hairy like for guys. Then I would get the pads, I would set it up, I would put the medication in, and no higher than 2. Most people would do 1.5 because it would usually overfill. Put the medication on here, squeeze it, put it on there, in here. I'm going to do positive. Oh, but beforehand, I would place the patient into a well supported position, then expose the treatment area beforehand. Set it up, then I'm going to do this. S1 is channel 1, S2 is channel 2, P is where you do the dosage, and you set the time, and where you can do the currency, and it's also for pause, and it's for the on and off time too. R is for run, then the equation that we use is dosage equals current times time. Then I would explain to the patient that ionto pushes the ions or medication into the skin by the sweat ducts without an injection. And the negative and the positive pads is that a positive medication allows it to repel, which it helps push the medication into the skin, because if it was a negative medication on the positive, it would just stick to the pad, it would not do anything. So I would also explain that to the patient. And the pads would be a pad apart with the part. Then I would begin with the thing. Then I would check with our equation. I would remove the treatment from the patient, put everything away, then I would clean off the area from the medication. Then I would ask the patient how it felt every 2 to 3 minutes during the procedure and make sure everything went okay. Then I would tell the patient that they would see like blisters and redness after it. Oh, and during the treatment they should feel tingling and it should not be painful. Then after they're done, I look for any adverse reactions like redness or bumps. Then I would make sure, and I would ask, do they have any questions?
Nope.
Okay, that's it.